Okay, so welcome to the deep dive. You know when you're trying to get your head around, like, a really big topic?
Yeah.
Today we're going to do a deep dive into how some neurological conditions impact our health.
Mm.
We've got three major ones lined up: epilepsy, Parkinson's, and Alzheimer's.
Right. Huge impact.
Huge impact. We dug through tons of information. I mean, so much research. And we really wanted to boil it down, just the stuff that's important for everybody to know about these conditions without getting bogged down, like with all the crazy medical terminology and all that stuff.
Yeah, like the nitty-gritty, but making sure that it's understandable.
Exactly, yeah. Just for everybody.
So we're going to try to unpack what makes each of these conditions, like, unique in their own way, right?
Yeah.
Epilepsy, those sudden seizures. And then we have Parkinson's, which affects movement. And then Alzheimer's, that progressive impact on our thinking and memory. And what's cool is, we looked at a lot of stuff, and they give us a really good baseline on their features. What are the problems that we see? How do we manage these? Like, what are the, important considerations?
Yeah, and that's what we're going to do today.
Let's dive in.
Okay, let's start with epilepsy.
Okay.
The first thing, what we found is it's defined as this chronic condition, recurring changes in neurological function. We know those as seizures. But it's not just those convulsive seizures, right? Like you see in the movies and stuff.
No.
It could be like changes in awareness or these involuntary movements, all stemming from irregular electrical activity in the brain.
Right. And that's the important thing. It's the brain.
The brain.
It's like where it all starts. But what's interesting is how varied a seizure actually can be. It can involve changes in sensation, thought process, even emotions.
Wow.
And it really emphasizes how intricate, how complicated the brain is, right?
Yeah.
And how a disruption in that normal pathway can manifest itself in so many different ways.
So many different ways, yeah. And when we talk about managing epilepsy, one of the key takeaways is understanding how well it's controlled through medical consultation.
Yeah.
If it's not controlled very well, routine treatment might need to be approached with caution or even postponed.
Right. Makes perfect sense. Like, if it's not controlled, you don't want to do something to, make it worse.
Right.
Potentially trigger something or complicate things if a seizure does occur.
Absolutely.
And then, the information highlighted stress as a big trigger, right?
Yeah.
For some individuals.
Yeah.
And in cases if it's not well managed, they'll use anti-anxiety medications or sedative medications,
Yeah.
So it's all about minimizing that risk.
Reducing the risk, yeah.
Of a seizure happening.
Right. And even practical things like discharge the patient slowly.
Yeah.
So they don't have that sudden drop in blood pressure, like orthostatic hypotension.
Right.
I feel like we see that a lot.
Absolutely, yeah.
We try to get people out too quickly. And then there's specific drug interactions that are flagged as important.
Right.
Like propoxyphene or erythromycin combined with carbamazepine, which is an anti-seizure medication.
Right.
It can lead to toxic levels of carbamazepine in the body.
Right, which is dangerous.
Very dangerous.
Yeah.
And that's important to know.
Absolutely.
Yeah.
And similarly, aspirin and NSAIDs, they should be used carefully.
Yeah.
Especially with patients who are taking valproic acid because it can increase their bleeding risk.
Yeah, we got to be so careful.
Yeah. And it's because of how it affects platelet function.
Platelets, yeah.
It's these tiny little details are so important.
Yeah, absolutely. So important.
They can really affect patient safety, so we got to be careful.
So if a seizure does happen,
Mm-hmm.
what are some of the signs? And what does it look like?
Right.
They describe something called an aura,
Right.
which could be like a flash of light or sound or a weird smell.
Right.
And that sometimes precedes a seizure, right?
Yeah.
And then mental confusion, excessive drooling, eyes rolling back.
Right.
Then they lose consciousness.
Yeah.
Enter what they call the tonic phase, with muscle stiffness, teeth clenching.
Yeah.
Then it progresses to this clonic phase where they have jerking and convulsive movements of the arms and legs.
Right. So there's a sequence, things are happening, right?
Yeah, it's like a progression.
Yeah, a progression.
Yeah.
So it's important to be aware of that. And, the information gives us clear steps too. How do we prepare for this? How do we respond?
Yeah.
And, they suggested using a ligated mouth prop.
Oh, at the start of a procedure.
At the start of the procedure.
Yeah. Yeah.
Which is interesting. I'm sure that's a judgment call depending on the patient and, how risky things might be.
Absolutely. It's
Yeah.
like a case-by-case thing.
Exactly.
And during a seizure, the priority is the patient's safety, obviously.
Of course.
So get the dental chair into a supported flat position.
Right. Right.
Clear the area around them so they don't hit anything.
Hmm.
And turn them on their side to keep their airway clear and prevent aspiration.
Right.
And then they even mention passive restraint,
Mm.
which I guess means guiding their movements gently so they don't hurt themselves.
Right. Without trying to, like, stop the seizure.
Right, without trying to stop the seizure itself.
So
Right.
nicely, yeah. Just, like, gentle guidance.
Yeah, just kind of help them out.
Right.
So, and once it's over, it doesn't stop there.
No, the care doesn't stop. You got to check for injuries, like anything that might have happened. Stop treatment and, figure out the transport. How are they going to get home or to where they need to go, to recover.
Yeah.
It's really like a comprehensive approach.
Yeah, absolutely.
Yeah.
Now, for you, what stands out as the most critical piece of information regarding managing epilepsy from these sources?
I would say the information on status epilepticus, that's where the seizure lasts for more than 5 minutes.
Oh, wow.
That's where it's really dangerous.
Yeah.
And it's so important to call 911 right away.
Immediately.
Yeah, that's like the first thing.
Yeah.
And then you start administering the meds, right?
Right.
Diazepam, lorazepam, midazolam.
Yeah.
And if it continues for another 5 minutes, they said give another half dose.
Well,
So it's like time is of the essence.
yeah, time is critical.
Really critical in status epilepticus.
Absolutely. Okay, let's move on to Parkinson's disease.
Okay, let's do it.
So the sources that we looked at, they describe it as this progressive neurodegenerative condition affecting the neurons in the brain that produce dopamine.
Oh, wow.
So it's the loss of these dopamine-producing cells that leads to all those motor symptoms, right?
Right.
The tremors, the muscle stiffness or rigidity, slow movements, bradykinesia, and problems with balance, postural instability.
Right. So it's all about the dopamine.
The dopamine.
Yeah, and it's just interesting how this localized issue in the brain, right, can have such huge effects on the body. And it emphasizes, similar to what we talked about with epilepsy, like, how well is the Parkinson's controlled?
Right.
Through consultation with the physician. And be cautious, right?
Yeah.
With routine treatment if it's not managed well.
Absolutely. Yeah. And that muscle rigidity, that's such a classic sign of Parkinson's.
Yeah.
It can make it really hard to maintain good oral hygiene.
Right, and it makes sense. You're stiff, you can't really move.
Yeah.
So they suggest, mechanical toothbrushes could help a lot in those situations.
Yeah, that makes sense.
Yeah.
Just to ensure adequate plaque removal and good oral health.
Yeah.
Right. And again, slowly discharge the patient to prevent orthostatic hypotension.
Right. It's important in both conditions.
Yeah, both conditions. And then, just like with epilepsy, potential drug interactions.
Right.
Like erythromycin should be avoided in patients who are taking the dopamine agonist pramipexole, also known as Mirapex.
Right. So again, taking a good medical history is super important. Super important. Yeah.
Like you really want to know what the patient's on.
Absolutely. And they brought up xerostomia, dry mouth, as a side effect of Parkinson's meds.
Right.
And using salivary substitutes can help with that.
Right, so they're not so uncomfortable.
Yeah. Yeah, exactly. Make them more comfortable. So using epinephrine and local anesthetic requires careful consideration in patients with Parkinson's.
Okay.
So the recommendation is to limit it to 0.04 milligrams,
Okay.
which is equivalent to like 2 cartridges of a 1 to 100,000 solution.
Okay, so limit the dose.
Yeah, limit the dose. And it's interesting. They don't really report any specific bad interactions between COMT inhibitors,
Right.
like tolcapone and entacapone,
Okay.
and like normal dental doses of epinephrine.
Right.
But they still advise caution and suggest limiting the dosage.
Right, which is interesting, but I think, being cautious is never a bad thing.
Never a bad thing.
Especially with Parkinson's. There's just, a lot going on. Absolutely, yeah. So beyond those, like motor symptoms, right?
Right.
The sources say that a mask-like facial expression, a fixed stare, and excessive sweating can be indicators of the condition.
Oh, wow.
Yeah, and then excessive drooling from difficulty swallowing the saliva, and that distinctive Parkinsonian gait.
Right.
That shuffling walk with short steps and reduced arm swing.
Right. I mean, it really paints a picture
Yeah, it does.
of what it looks like.
Yeah, absolutely. And as Parkinson's progresses, the management strategies change too, right?
Yeah.
So they mentioned using dopamine agonists, which makes sense.
Right.
Because they're deficient in dopamine.
Exactly.
And they also highlight the role of catecholamethyl transferase, or COMT, inhibitors,
Right.
like entacapone, to manage those fluctuations in motor control.
Right, because it's not always the same, it
It
fluctuates.
goes up and down.
Yeah.
And it's important to remember it's not just a motor disorder, right?
Yeah.
They mentioned serotonin reuptake inhibitors for depression, which is a common co-occurrence.
Right.
And acetylcholinesterase inhibitors for dementia, which can happen in the later stages.
Yeah.
It's more than just the tremor.
It's multifaceted.
Yeah.
Yeah.
Okay, lastly, let's look at Alzheimer's disease, which the source is presented under the umbrella of dementia.
Right.
Described as a syndrome that's usually chronic and progressive.
Yeah.
It's all about that decline in cognitive function,
Right.
and it impairs a person's ability to think, interferes with daily activities, and ultimately leads to a loss of independence.
So it's important to remember dementia is like a general term, like a decline in mental ability. But Alzheimer's is the most common cause of dementia.
Got it.
And that definition that we've looked at, it really emphasizes how big of an impact it has on cognitive abilities and how it affects everyday life.
Yeah.
And again, just like with epilepsy and Parkinson's, a thorough medical consultation is super important.
Yeah.
Right. And proceed carefully with routine treatment if it's not controlled.
Yeah, that's the same across the board, isn't it?
Yeah, it is. But they did make a distinction that for people with mild to moderate Alzheimer's, routine dental treatment is generally okay.
Okay.
But they did point out that there's a higher chance of seeing different oral health problems,
Whoa.
like dry mouth, mucosal lesions, candidiasis, plaque and calculus buildup, periodontal disease, and both root and coronal decay.
Wow.
Yeah.
That's a lot.
Yeah.
So salivary substitutes can help manage the dry mouth,
Yeah.
just like with Parkinson's.
Yeah. Oh, again, same thing.
But the thing that really stood out for me was the patient's cognitive abilities when you're making a treatment plan.
Right.
Like if the patient can't give informed consent, you have to get it from their legal guardian.
Super important. Yeah.
Yeah.
The ethical and legal stuff.
Absolutely.
Now, biologically, what's going on in Alzheimer's?
Okay.
Well, the sources pointed to the deposition of beta amyloid plaques in the brain.
Okay.
And this causes inflammation, oxidative damage, injury to the neurons, and eventually loss of these cortical neurons.
Right.
So there's less neurotransmitters for learning and memory, with acetylcholine being a key one.
Right. So that explains why it's so devastating.
Yeah.
Like the amyloid plaques and all the stuff that happens after that, the damage, it really explains why we see that decline
Yeah. Okay.
in thinking and memory.
So as we wrap up this deep dive, it's just so striking how each of these conditions, epilepsy, Parkinson's, Alzheimer's, presents unique challenges, whether it's the seizures, the motor impairments, the cognitive decline,
Right.
the impact on overall health and well-being is just huge.
And the material we looked at really emphasizes careful management, awareness of the drug interactions, the complications, and really understanding what these people are going through.
Absolutely, yeah.
And it highlights communication between healthcare professionals,
Yeah,
working together
absolutely.
to provide the best care.
And here's where it gets really interesting. When you think about how connected our neurological health is with every other part of our lives,
Yeah.
what are the implications for society?
Right.
For understanding and managing these conditions, from our healthcare system to our social support networks, and just like how we support these individuals and their families who are dealing with these complex conditions.
Right.
It's something to think about.
Yeah, definitely.
Thanks for diving deep with us today.
My pleasure.